Good afternoon, everyone. My name is Betsy Underhill, and I'm the marketing director at Mountain Valley Treatment Center, a residential treatment facility for adolescents and young adults with anxiety and anxiety-related disorders. We're here today to talk about parenting and the anxiety epidemic as part of a monthly series of virtual webinars we're holding to discuss various topics around anxiety and anxiety-related disorders. I'd like to introduce Dr. Lisa Rosen, Mountain Valley's Parent Support Program Director, who will talk about how parents and professionals can respond to the rising anxiety epidemic in children and teens. For those of you who don't know Dr. Rosen, she's been at Mountain Valley since 2019, joining the team following her youngest daughter's treatment at Mountain Valley in 2018. Prior to becoming our Parent Support Program Director, Lisa was the founder of a health and wellness center for teen and tween girls in Syosset, Long Island called Oh My Girls. Lisa is also trained in rehabilitation psychology and has worked for many years as a cognitive remediation coach in New York City with individuals with traumatic and acquired brain injuries. Lisa received her BA in psychology from the University of Pennsylvania and her doctorate in clinical psychology at Furkhoff Graduate School in 1997. She and her husband, Jeff, recently moved back to New York City from Long Island and have 3 young adult children. Following Dr. Rosen's presentation, we have built in time to ask questions, and we'll use the Q&A feature to do so. And with that, I'll turn it over to Dr. Lisa Rosen to get started.
Thank you, Betsy. Hi, everyone. So I am going to just share that this is a presentation I'm incredibly passionate about, and I've done often, but not in a 20-minute window. So I'm going to do my best to put as much content in here as I can, and I know we have a little extra time afterwards for questions, but if I'm speaking very quickly, there's a reason. I have a lot to share, and I'm going to try to get it all in. So I'm assuming we have an audience mostly of parents and maybe professionals who are working with children and young adults who have anxiety disorders, or who maybe are wondering if their kids have an anxiety disorder. So I want to start with, as the role of a parent, and as Betsy mentioned, having raised 2 children with significant anxiety profiles, where to start the process. And I'm going to say, most importantly, to educate yourselves. What is anxiety? How is it defined? And how do I decide if my kid or a child we're working with needs treatment for their anxiety? So understanding that just the most basic definition of anxiety is an overestimation of danger and an underestimation of a child's ability to manage that danger. So that's like the most baseline understanding of how to understand when is something defined as anxiety beyond what is sort of an appropriate amount of worry about an appropriate situation, right? It's thinking something is bigger than it is, more scary to them, and thinking they can't navigate the fear. And many of our kids who have been diagnosed with anxiety often have additional diagnoses like an executive functioning challenge, ADHD. Often anxiety comes with a secondary diagnosis of depression. Deciding and understanding which one of those is primary can be very important when you're looking at treatment approaches. When should we seek help? And dual diagnosis, of course, there are kids who are also, we have kids with oppositional behavior issues that might also have a dual diagnosis of anxiety, kids with eating disorders. So anxiety can often be masked by other diagnoses. And so I'm going to go down to the next bullet. What's the first step in getting the right diagnoses? I would say starting with professionals, a psychiatrist, a psychologist, consult, and a neuropsych evaluation. While it can be arduous, certainly a psychosocial evaluation by a school can be really helpful to start, but the value of a neuropsych, a full neuropsych battery, cannot be underestimated. It is so incredibly important and helpful if you are struggling to decide, does my kid have an anxiety disorder? Is it an anxiety disorder in addition to something else? So really starting by just asking the right professionals, getting the right questions answered. How do we know when to seek help? We work with teenagers at Mountain Valley, obviously, and so teenagers tend to be sassy and a bit difficult anyway. So the first question I would say to ask yourselves is, how is this impacting my child's ability to function and do the things, the job of being a teenager. And for each of us as parents, we might have a different definition of the thing, but ultimately a teenager's job, a kid's job, is to be able to get up in the morning and to go to school, ideally to be able to socialize, and potentially to do their homework and some after school activities, but really primarily, is your child able to get up, get out of the house, and go to school? And when their anxiety really impacts just that most baseline ability, we talk about ADLs, attention, activities of daily living. When they are struggling with those types of things like showering, getting up, getting dressed, coming to the breakfast table, sitting with other people, this is when you probably need some help. Obviously, as a clinician, I never think it's a bad idea to get your child some therapy if they're asking for it, but paying attention to when should we be worried? So how can we empower our parents? Because we are in the field of working with teenagers who often are very resistant to getting treatment or asking for help. One of the beauties of my job as a parent coach and the director of parent support is helping parents understand how much they can, in fact, play a role in their child's healing, and in alleviating some of their anxiety profile. So what we have learned over many, many years, and what I am constantly lecturing and talking about, and what I am so passionate about, is helping parents to understand what they can do. And there is, in fact, a lot. While anxiety and OCD are two of the most treatable mental health challenges, and they are treatable, while they're not curable, as many of you probably know and have learned in the media and beyond, and in any readings that you're doing and movies, there are very, very successful adults with anxiety disorders and OCD. So it is, in fact, very treatable. And what we also know is how impactful parents can be in helping young adults and young children, young adults, adolescents, and children overcome anxiety disorders. So I'm going to sort of delve a little more into what space treatment is all about. This is a model that is one that all of our Mountain Valley clinicians are trained in, and one that we is something I'm incredibly passionate about. So SPACE is an acronym. It stands for Supportive Parenting for Anxious Childhood Emotions. The website address is right in front of you. SPACE is a program out of Yale, founded by the director of Yale Child Study. His name is Elie Leibowitz. There is incredible literature on that website and clinicians who are SPACE trained on his website. And parents are embracing this model because SPACE is a model for parents exclusively. So it is a 12 to 14 session treatment approach for parents raising anxious children. And this is for parents whose kids are maybe willing to go through exposure response prevention and cognitive behavioral therapy and acceptance and commitment therapy and all of the treatments that are evidence-based, successful with anxiety disorders for your child. And also SPACE can be a treatment approach where your child does nothing. If your child is locked in their room, refusing to go to school, has any sort of social anxiety, contamination anxiety, any of the profiles that we're talking about, and is refusing treatment, it is incredibly empowering to know that you as parents can actually do something, a 14-session manualized approach to treating your child's anxiety. So I'm going to share a little bit about what the SPACE model really talks about. This is a toe dip, so to speak, into the model. And it starts with understanding accommodation. And this is in contrast to academic accommodations and IEPs and 504s. So this is parental, or really any family member or support person in your child's life who accommodates, which is defined as adapting or modifying your behavior in order to reduce your child's anxiety. These are behaviors that we engage in as parents, as coaches, as teachers, as mentors, as grandparents, that make it less likely for our child to actually mature, grow, and learn that they can overcome their challenges. So why, if we know that it's not helpful, and why would parents and why would these support systems accommodate an anxious child? Well, we have an intrinsic desire to reduce the suffering of the people we love. So we accommodate because it makes our kid feel better. Often it makes us feel better. If you read the manuals on how to parent from a very young age, and if we think historically about parenting, we have a mammalian instinct to protect our young and to comfort them. And when we don't do that, we feel like failures. And so Ellie Leibovitz, the founder of the space model, has said 100% of parents who have anxious children accommodate. Why is that important? Well, it certainly takes the blame. It alleviates some of that feeling of guilt and blame that we have as parents. It normalizes that this is a behavior that we are sort of instinctually leaning into because it's protecting our children. And ultimately, it is counterintuitive to not accommodate. And yet, this is exactly the approach that we are supporting and seeing amazing results, that it helps our children be more successful. So why else do parents accommodate, or coaches or mentors? It allows for an immediate relief. What are we all afraid of? Well, we're afraid our kid will fall apart. We're afraid they'll fail school. We're afraid their friends will not like them. They won't have a social life. We're afraid they'll be living in our basement for their entire lives. We're afraid we won't be able to put the bumper sticker on the back of our car about the college or the program that our kid got into, right? So as parents, there's lots of investment in seeing our kids not struggle, not suffer, and trying to help them to be successful. What are some examples of how parents accommodate? Going out of your way to avoid a stressful situation. So knowing that your child is has to be at an event or a party, and really making excuses, finding reasons why they don't have to go, skipping social events, choosing not to RSV yes to a party or go to a show or take your child out. We've had parents who actually won't even get on highways because it makes their children so anxious they take side streets to avoid the highway. Rescuing your child from the consequences of their own choices. This is my kid didn't do their homework. I'll call the teacher, tell them they were feeling sick yesterday. Can they have an extension? Ignoring or avoiding an issue your child doesn't want to discuss. So knowing something they're not going to be looking forward to is in the future, and just sort of choosing not to tell them about it, maybe until the moment it's about to happen, because you know they might unravel or become dysregulated. Doing something for your child that they are capable of doing for themselves. Full disclosure, my 15-year-old, before she was at Mountain Valley, I used to bring her toothbrush and a cup of water into her bed and brush her teeth with her in the morning in order to see if we could help her to sort of get out of her room. And that was one of many, many ways I accommodated her anxiety. How does this behavior impact your child's anxiety? Well, it allows your child to increase the avoidance of the anxiety-provoking stimuli. Gives us short-term relief, gives your child short-term relief and your family, right? It lowers the temperature in the house. It allows for everybody to be calmer. So there is relief. It also can lead to long-term enhancement of the anxiety and dysfunction, which we're going to talk about in a minute. Always hinders growth and recovery. It reinforces for your child, when you engage in these behaviors, that you don't think they can do the hard thing, that you think they need to be rescued or protected or fixed or helped. It maintains their dependency on you or whomever else is accommodating them. And we're going to talk about the anxiety spiral very quickly. Oh, I lost my anxiety spiral slide. It'll come in the future, but I'm going to tell you about the anxiety spiral. So this notion that your child has a fear cue, something they're afraid of. Let's say it's a dog across the street, and they're afraid of animals. And so they have this bigger fear than is realistic, right? The overwhelming fear and an underestimation of their ability to navigate that fear. So what does a child do? They avoid it, right? They run away from the dog across the street, or they say, Mom, can you move me? Can you not take this path because there's a dog in the road? So how do we accommodate? We grab a car, we don't go on that route, we avoid all dogs, we stop going to all parks, right? We just make sure if our kid's going to a play date that we call in advance to say, is there any dogs there? Because my kid's afraid of dogs, right? So this is how we sort of over accommodate. And what does that lead to? Relief. Everybody feels better, the temperature goes down, and ultimately your child has not learned that dogs aren't dangerous or that they can manage their anxiety. So this is the spiral. Dogs become just as dangerous, even increases the fear cue. Right now, I just know that dogs are dangerous because even mom and dad are telling me they're dangerous, or they're engaging in these behaviors that make me feel like they know it's scary. And so this is sort of the spiral. Ellie Leibovitz talks about supportive parenting, and this is an enormous shift from accommodative parenting. And he talks about it as the mac and cheese of parenting. So the macaroni is, well, let me define support and then we'll talk about the mac and cheese. So how is support defined? It's behaviors that we engage in that make it more likely for our child to lean into their own, tap into their own abilities, more likely that they will mature and grow. It sends a message to their child that they are capable and strong. And it actually allows your child, this is one of my favorite phrases, the opportunity to fail. With opportunity, your kid can then learn what they need to do to be successful. Here's our mac and cheese I was referring to before. The ingredients to supportive parenting are super simple. Like I said, Ellie calls it the mac and cheese. So validation plus confidence. Validation and empathy are often used interchangeably. So what does that look like? I know how hard this is for you. I hear you. I know you are suffering. Often parents raising anxious children get very caught up in a loop of either fear or anger or frustration as their kids are begging them to fix it, to help them, to do something, please. And it feels like it's intentional, like they're trying to really make your lives difficult. And while many teenagers are meant to make lives difficult for their parents, anxiety is hard and it is painful and it really does hurt. So if you can start from a place of empathy for your child, I know you are really struggling and I see how hard this is for you. The other ingredient, the cheese, which is essential because if they don't go hand in hand, supportive parenting doesn't work, is confidence. I know you can do this. I know you can face that dog across the street and that you will be okay. I 100% believe in you. Conveying to your child that they can tolerate this distress. The intention in supportive parenting in the SPACE model is not to see your child's behavior change, although that is almost always a byproduct of moving to a supportive stance. But the intention is just to change your behavior. So what does that mean? Your child will hate this. When you remove accommodations and you say, I believe in you, I know this is hard. And so tomorrow I'm going to leave your toothbrush and your toothpaste in the bathroom. And I know you can get out of bed and go to the bathroom and brush your teeth. I know that you can walk down this block. So I'm not going to go a different route. We're going to walk together down this block. Your child will say, I can't. Your child will cry. Your child, and in fact, Ellie Leibovitz and this model sort of expect there to be pushback. So if your child isn't struggling when you remove the accommodation, you're probably not removing the accommodation. It should be hard, and we don't expect your kid to like it. And we do like to plan ahead. So in the SPACE model, there is an intention where you speak to your child or even write a letter to them about what you're planning to do. So I know this is hard for you, and starting tomorrow, I'm going to do this thing. I don't expect you to like it, but I also know 100% that you will be able to do this. The message to your child is that they are not fragile, and it reinforces their resilience. Very important to recognize your role as parents, as coaches, as caregivers, and how do you model distress tolerance while you're reducing those accommodations. So a few of my other favorite quotes that any parents I've worked with will hear me say often: be a bigger container. So first and foremost, allowing your child to dump, to say, I hate this, I'm scared, I feel terrible, feels unbearable, I can't do this. Really helping your child to see you as a safe space to sort of dump. Betsy, I see it's 1:20. I'm going to plow through the next 3 slides and then we're ready for questions. Be able to sit with it yourself. So if you are really struggling with your child's distress, to be able to say to yourself, can I stay in this room with my child, or do I have to kind of pass the baton to someone else? You're asking your child to do hard things. ERP is an acronym for exposure and response prevention. It is similar for you as parents. It is hard. It means sitting with your own discomfort. And so we talk about this parallel process of ERP where you're asking your child to do the hard thing and sit with it. Supportive parenting is very similar. You're going to do the hard thing and try to sit with it. And check in before you dig in because it is hard. So make sure you're checking in. Am I behaving in a way that's going to rescue my child, try to fix my child, give them, am I sending a message of confidence in them? Last slide, the home team approach, recognizing that as parents, we are often the most dysregulated person in the room when our child is anxious, and that makes sense. And so being able to say to your child, not just, I can't do this, I'm out. I don't feel like I'm helping you right now. I feel like we're going to talk to some other people who can help you. I'm going to leave the room and I'm going to call someone else. So a home team approach is recognizing who else might be able to support your child in difficult moments. And both as parents, we ask our parents to have a home team, and we ask you to consider who the home team for your child can be. That can include coaches, teachers, clergy, best friends, cousins, family. But asking your child, who would be a person that I could call when you're really struggling that might be able to help? And setting up a home team for yourself and for your child is crucial for supportive parenting. Okay. Questions, comments, Betsy?
Yeah, so at this point, if anyone has a question, you can use the Q&A feature to ask questions for Lisa. And thank you, Lisa, for going through a really, really great presentation. All right, we do have our first question for you. How do you determine who is a good person to be on your child's home team?
Excellent question. And really, it starts with asking your child. So explaining what the home team concept is all about, which is, as much as I love you, sometimes I'm not going to be able to be helpful to you because sometimes I'm too close to you and I want to protect you from pain. And I am learning how important it is that you tap into your own internal resources. So who makes you feel safe? Who are the people that you feel like you could talk to in a really hard moment? It's important to set up the home team before you engage, before your child's really struggling in a moment. So it's not a question like, I see you're really having a hard time. Who am I supposed to call? Right. But I will say that many of our kids choose friends. It's important to recognize kids are kids and sometimes they're not reliable. So a friend is great and more than one person on a kid's home team. Like I said, clergy, coaches, cousins, and it is important that your child shares with those people that they are on their home team. So for instance, a typical narrative for a kid is, hey, I struggle with anxiety sometimes, and I'm learning that it's helpful that there are people I can reach out to in hard moments. Would you be willing to be on my home team and available to me in a hard moment? And so sharing with people for yourself and for your child that they're part of the team is important.
Right. All right, next question. Would this response be different if the source of the anxiety is trauma or PTSD?
Yes, and it's still very effective, but you also want to make sure your child gets the proper type of trauma treatment. So trauma, there is a completely separate approach to trauma treatment. And so I would say engaging in a space model while your child is also getting the trauma treatment that they need would be a really great marriage. I would not do space without making sure that the trauma treatment is being addressed as well. And that is a priority. And there is wonderful treatment out there for trauma now. Big T and little t traumas.
Okay, next question. How does the program advise parents' response when they've said, you can do it, and the kid can't?
So no kid can do it the first time, right? And so it's an interesting question in confidence when we talk about empathy and confidence. So I often get parents saying to me, I don't actually think my kid can do it, right? I've seen my kid completely unravel. I've seen, terrifying things. And we're a residential treatment program. So we have our kids have been through some really challenging times. The answer is if your kid really can't, then that may be a time to seek a higher level of care for them. And ultimately, where does that can't lie? Is it your fear? And are you willing to let your kid kind of fail to succeed, right? So can you tolerate an unraveling? What does that look like? Missing a day of school, needing to, increase the therapy for your child, or, struggling. We often expect our kids, especially when we have kids with school avoidance or school refusal, or an ARFID kid, or real struggles that are big. We expect it to take time. So supportive parenting you don't just latch on and it works, right? So for the first weeks or so, it can be very hard, and your kid can feel like they can't. And being confident and consistent and saying, I hear how hard it feels to you, and I see you're struggling. I know you can.
Next question. How do you know when it's time to seek outside help?
Again, it's really about how much is the anxiety impacting your child's ability to do the things that children need to be able to do. And also in line with your child's values and your family's values, right? Needs to be able to do and wants to do. So if your child is not able to get out of bed, not able to do their activities, they're showering, they're, dressing themselves, all of those most obvious things. But then it moves to, can they get to school? Can they stay in school? Can they get through a whole day? Can they do their homework? Do they engage socially? Are they able to do the things that matter to them? So if your child is finding that they are an avid horseback rider and they can't get on a horse, right? Or if they are, passionate about art and they're not able to open an easel and a paint can anymore, these are ways So first and foremost, look at the most basic functioning, and your child needs to be able to go to school. It's the job of being a kid, right? And so that's where we start baseline with, then they need help if you're really struggling with that. But again, if it's impacting their life and you're finding your kid isolating in their room and struggling to find joy in their lives, and the anxiety is impacting their ability to do what matters to them or to your family, that's a time to seek help.
Great. All right. Next question. Any tips on dealing with really young children? My daughter is 3 with a rare genetic disorder and an ASD diagnosis. She is showing OCD tendencies, and we are doing ERP with a BCBA. A lot of the advice is geared around talking through anxiety, but she can't really verbalize her emotions yet.
Yeah, not yet. God, that sounds really hard. ASD and anxiety disorders go very often hand in hand. I would say, was the question how to navigate it early on? I would say
Yes.
really seeking out a home team. I mean, with that level of challenge for you right now, getting your professionals in place, helping your child to get the help they need, and really just getting the support of a home team for yourselves is where I would start now. It's a very young age, especially with a dual diagnosis like that, to start doing any sort of space work, I would say.
Okay. I think that was our last question, and we are at 1:30. So I'd like to thank everyone for joining today. And thank you, Lisa, for going through space program, and we really appreciate your time. And this recording will be available on our website, mountainvalleytreatment.org, next week. We'll also email a link out to everyone that registered, so you can look for that in your inbox next week as well.
Let me just add one thing. If you do go to the space page, you can ask questions. So in terms of that 3-year-old, I actually would wonder what Ellie Leibowitz himself would say about treating a 3-year-old. So I am not the expert. So I would say definitely check in with some professionals at Yale Child Study. Hop on that website to answer that question and find people who can answer it better than I did, maybe.
Okay. All right. Well, thank you all, and enjoy the rest of your afternoon.